Welcome to Dr. Lee Unplugged, real insights from the cutting edge. This is a stripped down video where I share behind the scenes insights as a scientist and as a doctor on different health and wellness topics. It's raw, it's direct, unscripted, no sugarcoating, just real talk and real science. And today we're going to talk about prostate cancer. Okay, so before we talk about the prostate, which is an organ that sits right between our cheeks in men, all right, and has a critical role for reproductive health and overall health. Let me actually introduce another topic that's going to connect to prostate health in a second. And that topic is angiogenesis, all right? And I study angiogenesis in the lab, and so I want to share with you what that is. Angiogenesis sounds like a complicated term, but angio, blood vessels, genesis, how our body grows blood vessels, is a really important process for health in our body because we have 60,000 miles worth of blood vessels. And these blood vessels, your circulation, these are the highways and byways that bring the oxygen that you breathe and the nutrients that we eat to every single cell in the body, including the prostate. Now, when we need angiogenesis, our body's going to be able to deliver that to us. So, for example, if you cut yourself, fall down, scrape your knee, cut yourself in the kitchen on a knife, you'll form a scab. All right, after the bleeding stopped, you'll start forming a scab, and it'll heal. But if you ever had a scab come off too early, what do you see? You see lots of bright red stuff underneath there. That's called granulation. That is new blood vessels, angiogenesis occurring, new blood vessels growing to actually deliver oxygen and nutrients, survival factors we call them, right to heal that wound. But when you've got just enough blood vessels healing up, that's it. It'll stop. Our body basically will just shut that baby down, all right? Now, on the other hand, if there's too many blood vessels, our body can actually control those as well. We know how to our bodies know how to inhibit angiogenesis, how to cut off the blood supply when you don't want too many. That's sort of taming blood vessels in the body. Now, where are the places where that taming process occurs really powerfully? Well, occurs in your eye, right? Our eye is a crystal clear ball. We do have blood vessels in there, but they're really very, very few, and they're tightly controlled. If you had out of control blood vessels growing there, the blood vessels would bleed and you go blind. And in fact, this is what happens in some of the blinding diseases and diabetes and aging, macular degeneration. The body loses control over angiogenesis. That's not a good thing. Another place where angiogenesis is tightly controlled normally is in our joints. Guess what? Our joints don't have blood vessels. They're avascular. And that's by design because you don't want anything interfering with that joint. It's just like supposed to move really smoothly. But when you actually have blood vessels growing in there abnormally, body loses control of angiogenesis. You know what happens? Those blood vessels leak fluid. Now your joints swell, and the blood vessels also bring in inflammation, inflammatory cells that release enzymes. And you know what that is? That is arthritis. Okay, and you can wind up having joint swelling and pain and destruction of the joints. So that's another example of where the body loses control. It's normal control over angiogenesis. Now, the other place where angiogenesis is tightly controlled is in the situation of tumors. So we form cancers all the time, including in our prostate. All right, I mean, our bodies are 40 trillion cells that are copy pasting itself all the time. And so when it makes a little mistake, or has a mutation, that abnormal mistake in copying and pasting leads to a microscopic cancer. Happens all the time. Children, adults, most of the time, we'll never notice it. It's like a pimple that forms on your back. Maybe somebody else behind you will notice it, but you'll never know it. And then the body takes care of it all by itself. And this is actually how we're beginning to reconceptualize, have a new understanding of cancer in the body. It's not like we were just hit with a javelin one day. Nope, we're forming cancers all the time. And our body, our immune system, and our body's ability to block the blood supply to growing cancers are really, really powerful for our health. Now, all cancers, including prostate cancer, start as microscopic tumors. And because they don't have a blood supply when they start, they can't get bigger than about 2 to 3 millimeters in diameter. You know how small that is? That's like the tip of a pencil tip, all right? Or maybe a small grain of rice, the tip of a half of a grain of rice, all right? And without a blood supply, no angiogenesis, cancers can't grow, right? They need oxygen, they need nutrients, no blood vessels, no nutrients, no oxygen. That's about as big as they can actually get, all right? Then what happens, and our body can do that, it can actually prevent angiogenesis from happening. And then what does the body do? Their immune system is conducting surveillance, swings by, sees that microscopic cancer. Aha, I see it. And then your immune system takes it out. And now you've gotten this microscopic cancer that's eliminated. And so it's not dangerous at all. So cancers can't grow without angiogenesis. But sometimes these microscopic cancers are sneaky, all right? And they find a way to stimulate and grow their own blood supply. They kind of hijack your body's blood supply in order to be able to feed themselves. Let me tell you how powerful this is. In the lab I trained at, there was a classic experiment, all right, that looked at the relationship between tumors and blood vessels and just how powerful blood supply is to cancer growth. What the lab found, the research found, is that if you actually kept a small microscopic cancer isolated from a blood supply, no blood vessels, all right, no oxygen, no nutrients, it pretty much stay there forever, like at that size, just couldn't get any bigger. But if you allowed blood vessels to grow up towards and touch that tumor, guess what? Bringing oxygen and nutrients, that cancer, that tumor would explode in size. It would grow 16,000 times in size just in 2 weeks. All right, so angiogenesis is a powerful, explosive growth engine, and that's why our body's defense against cancer is anti-angiogenesis. It knows how to cut off the blood supply to cancers. Now, it knows how to grow them where you need it, like if you have a wound, but it also can also cut it off, cut off the blood supply where it's dangerous. It's sometimes, however, all right, when you actually get clinical cancers, that's where the body generally has lost control over this system, and now blood vessels are growing and feeding the cancer. And what researchers are trying to do is to figure out how to regain control. All right, get these cancer cells out of the cockpit so you can take control of the stick again. All right, in order to be able to get those cancers starved by cutting off the blood.